Okay, now I'll call the meeting to order. Roll call.
George Bousset,
Here.
Clarence Campbell,
Here.
Richard Huber. Richard Huber, I don't think so. Matt McKenzie,
Here.
Laura Negro. Laura Negro. Dr. Keller, we know you're here.
All right, thank you.
Dr. Horning,
Here.
Laura Cruz,
Here.
Joy Henriksen.
Here.
All right, so we have quorum.
It just occurred to me that this is Joy's first meeting. Maybe we should have her introduce herself to us.
Yes, thank you.
I was afraid you were going to put me on the spot. I don't know. What do you guys want to know about me? I'm Joy Henriksen. I am a registered nurse. I am the director of infection control for the Ashland and the Hayward Hospital. I work quite a bit with Liz and some of you other folks on this panel here too. Been at the hospital almost 25 years. You guys want to know anything else?
I think that's good.
Okay,
Well, welcome to our board.
thank you.
Approval of the minutes of the last meeting.
I move for approval.
Second.
Motion made and seconded to approve the minutes of the last meeting. Any questions or comments? Otherwise, all in favor signify by saying aye or raising your
Aye.
hand.
Aye.
Aye. Opposed? Motion carries. Public comments. Anyone from the public wishing to make comments? Don't believe I see anyone. Then we'll move on to staffing and building updates.
Oh, I see Laura Negro has joined us
Okay,
for the record. Okay. I'm sorry, what? Can you repeat that, Clarence?
staffing and building updates.
Oh, that's me. All right, so we had a period of time where our custodian and maintenance helper was out for a period of time for medical reasons, and he is coming back on Monday, so we're extremely excited about that. He does a fantastic job. You will notice that Pete Hurlevy is missing from the meeting, as is Melanie Connors, so a little different take on the meeting. We've had Pete for so long and Melanie also, but we're welcoming Amy Piketty and Amber Erickson. So Amy is taking Melanie's spot as the economic supervisor, and Amber has moved over from the highway department to take Pete's spot. And they are both doing great. They have experience with the county, and they have kind of jumped into these new roles head on, and they're doing great. We have pretty much settled into the Sanborn building. As you know, we moved everybody very, very quickly over from the downtown 514 West Main building. We're pretty cramped in there because we have 3 new staff who are also starting. We have hired 3 people for our economic support unit. One will take Amy's spot. We did have 1 person leave, so they will fill that spot, and we got permission to hire another position that is fully funded by the consortium. So we are full. We're doing fine. Everybody, we have enough room for staff. The only thing is we still have lots of our files that we're required to keep for 7 years in the basement of the 514 building. So if there's movement with that building, we will have to secure some type of secure storage for that. So just keep that in mind. Right now, we're good, but Dan may have some updates for us in the future as to the 514 building and the proposal for that. We also have a almost finished new handicap accessible ramp for the public health entrance. The current structure was rotting, literally falling apart. The handrails were falling off. It wasn't ADA accessible. And Liz received a fabulous grant to fund the whole thing, and it should last well past my lifetime. And it looks great. And it's ADA accessible. So kind of helps the outside of the building look a little nicer, and it's like I said, it's going to be durable for a long time. And I think that's all I have on that. If you have any questions.
No questions, then we'll move on to number 5, high-cost youth placements and creative alternatives.
That would be me. So as I'm sure some of you have seen in some of the financial materials, the children's unit has been going through some pretty difficult times with the costs of our placements, our court-ordered placements in out-of-home care for children and in youth justice cases. For example, we have 4 kids currently that are placed outside the home at Rawhide, and that is, those 4 kids account for about $60,000 a month that we're paying out in out-of-home care. We are finding that there are multiple factors that are kind of going into the issue of the high cost of placements. One of which being youth that are considered to be high acuity or complex needs youth. We currently have one complex needs youth that is placed in Pennsylvania. I think we've talked about this kid before, but and that one placement is costing the county over $21,000 a month. The difficulty with the high acuity or complex needs kids is that with the combination of issues that these youngsters are having, we are completely unable to locate placements within the state of Wisconsin. So for instance, the kid that we have in Pennsylvania, he is only 10 for one thing. So that will cut off a big chunk of the residential settings that we could utilize based on their licensing. He has some significant aggressive behavior. He also has mental health diagnoses. And I think just recently they diagnosed him on the autism spectrum as well. So when you take a combination of issues that a kid has, it makes it that much more difficult to find a single institution that is willing to provide care for those children. That's why, for him in particular, that's why we ended up with a placement that is so far from home and unfortunately very expensive. Other issues that are kind of feeding this problem. A lot of it comes down to staffing shortages that everybody has seen from COVID going forward, which has led to a lot of closings of institutions and group homes that we have utilized in the past. We used to have a group home in Hayward that closed due to staffing shortage. Eau Claire Academy, which was a long-standing institution in Eau Claire, part of the clinic care operation that was statewide, has recently closed. And now clinic care is down to 1 facility in Milwaukee, and that's it. They used to have 4 in the state of Wisconsin. So the way that is really impacting our costs is that we are having a harder and harder time finding beds for youth that would ordinarily be appropriate for those beds, simply because there are a shortage of beds, and the individual providers are frankly much more picky in terms of the children that they will take and won't take. And we end up having to scramble and look elsewhere for placements that typically are higher in cost. Another issue that we're finding just happen to be in the state of Wisconsin is that the state of Wisconsin actually sets the rates for both group homes and child caring institutions. And we have no ability to pay any additional funds above and beyond that. That being said, the institutions will prioritize kids from out of state that they will accept into their facilities rather than taking in-state kids, because it pays more. And again, we are stuck with a situation where we're not able to find beds that are appropriate for our youth. I think I thought I had one more, but I can't think of what it was now. Do you remember what it was, Derek? No, I don't remember. So anyway, those are all factors that are going into what we're seeing as a significant increase in the amount of money that we're paying out for our out of home care. And so that was just, part of what I wanted to kind of just bring to your attention. Another really interesting thing, and this is where I'm going to watch for Laura's ears to perk up, is that there is a grant that LSS is in the process of applying for. I believe it's due at the end of this month, the 29th or 30th. And Terry and I have signed on with a letter of support for LSS in pursuing this grant. But the grant is for developing licensing and training of specialized foster care for caring for the youth that are high acuity or complex needs kids. We've seen this trend starting in Milwaukee. I think it was just late last year they started doing it.
Jerry, the state finally told us, but they had been doing it for years, and it finally came out. They've been doing it, but you need to understand this. We call it the state of Milwaukee, but the county of Milwaukee is run by the state Department of Children and Families. So the state's been doing this for years, and we've literally been complaining, as far as I can recall, since 2015. And they've never offered this up as something we could explore. And we figured it out, and they kind of fessed up. And
yeah, nice of them to share. Anyway, the idea is it goes to the idea that you have professional foster homes. So the way that they've gone about doing that is that typically speaking, they'll have a private licensing entity come in and license homes that they have specifically recruited, Laura, to get licensed. And then the county contracts with the specific provider, Laura, and there's like a salary that's paid to Laura in the amount of $40,000, $50,000, $60,000, $1,000 a year for them to provide specialized care to one of these high complex needs youth. And then on top of the kind of salary, there is also the compensation that a foster home would typically get based off of the CANS assessment and the rate setting that we do for all kids that we have in foster care. So LSS will be working on developing this program. I think that initially they're looking at their initial goal is to do 4 homes, which doesn't sound like a lot, but it's a start. And that has been something that Terry and I have been looking into and kind of talking to a few people, Laura, here and there. And we've had a little bit of interest, but nobody quite like Laura. But we're thinking that that this could be really a great avenue for us to save a ton of money. So I mentioned the kiddo that we have in Pennsylvania, $21,000 a month to provide care for this youngster. When we have a perfectly qualified person with an excellent skill set that could potentially do that in their own home, paid at a professional level to do so, and save the county hundreds of thousands of dollars. So I really think it's a valuable thing for us to be looking into doing. And I'm really hopeful that LSS kind of plows that road for us a little bit, and we can follow their lead. Any questions from anybody? Laura? Just checking. We can't hear you.
I don't know. Sorry about that. So can you hear me now?
Yes.
Hello? Okay. So you mentioned that the county is paying, let's say, roughly $60,000 a month.
No. For that, yes, for those 4 placements.
Does that include the right? Does that include the one that's in Pennsylvania?
No, the one in Pennsylvania is he's actually a kid that's on a CHIPS order. The 4 kids that are at Rawhide are all youth justice cases. Oh, it looks
Okay.
like she's locked up now.
Yeah.
Yeah.
Okay.
So there
I
is,
thought maybe you're gonna like look at more of a comp.
Oh,
I think we lost her altogether.
yeah.
Yeah.
She probably needs to shut off her video. I think we'd be able to probably catch her audio better.
George, do you have a question?
No, I was just noting that Rich Huber is online. I don't know if that had been noted.
that must be 6810672.
Yes, it is. Yes, it is.
Okay, welcome. We'll rename you here. So
Okay,
I just wanted to share with you that there's information in the packet that breaks down the amount of money it costs us every month for our youth who are placed out of home. And you will note the last several months, we started out the year looking really good. And I believe I said something out loud that jinxed it and it swung the other way. But it is well over $120,000 a month now for the kids that we have placed in out-of-home care. And like we mentioned all the time, these are kids who are on court orders. We always try to do the least restrictive setting that we can, and yet we end up with these institutional placements, which are, we have some very good institutions within the state of Wisconsin. But there are some youth that we really feel could be taken well care of in our own community, be close to their friends, family, and in their own school, and still get the services that they need. So these are things we'll be exploring. It's a win-win for the youth and for the county as far as finances go. So, we're not one to shy away from a challenge, and we'll be taking this challenge on. Are there any questions about that?
No, there isn't. Not from me.
Okay.
Laura, I see you're back. We really were having trouble hearing you. Did you want to try that again?
No, I'll chat with you later.
Okay, that sounds good. I'll have the paperwork all put together for you.
All All right, next item is public health emergency unwinding update.
I will take that one on also. We had fully intended when we made this agenda out to be able to inform you that the public health emergency was coming to an end. And we have been notified by, we were promised that we would be notified by the Department of Health Services 60 days before the public health emergency was to be ending. And as I've told a few people, I would have lost money because I would have bet that we would have received notice this week or last Friday, this week at the latest, that it would be ending. And it is not. So it appears that 2 Biden administration officials confirmed it will not end the public health emergency in January. And it's looking like it will remain in place until at least mid-April of 2023. So the reason this was on the agenda, and what we do want you to know, and I think we've talked about this before, is when this public health emergency does come to an end, a lot of the things we've been allowed to do because of the pandemic, so not having to do in-person, face-to-face visits, using some technology instead, those kind of things for our case managers will likely come to an end. There are some things that they have found are very efficient, and they've been working on changing the rules for telehealth and those kind of things. So we're happy those things will continue. But probably the most dramatic things that our residents are going to see are loss of some services, including right now, no matter what your income is, if you qualify for food share, you get the maximum benefit, which, Amy, I believe is around, what is it, 140?
281 for a single person, because they also increased the allotment due to the recent inflations.
Oh, okay. And it will drop down to potentially the lowest.
Minimum, this is really going to affect our seniors the most, and our disabled individuals within the community. The minimum, most of them are going to be eligible for the minimum, which is about $23, $24 a month. So they'll be going from $281 down to, I want to say it's 23 is the minimum. So they'll experience a huge drop in benefits.
While, as Amy mentioned, the cost of groceries has gone sky high. So it's going to be a double whammy for a lot of folks. And as we know, this has gone on for a couple of years where people have now continued to expect this, and probably most have not budgeted for any expected decrease in their funds. So I think it will be very difficult. And like Amy said, that's just for one person. So if you have a family of 5, you can times that pretty much by 5 and anticipate the drastic change they will have in their food budget when this change happens. So we do have the paper on standby, ready to get a story out, to get the news out. There is a plan for what they're calling unwinding once the public health emergency is ending. So there are plans in place for that. The unfortunate thing is not everybody opens their mail, will get notices because they may throw them out without looking at them. So we're trying to get lots of information out every way we can and try to prepare people, because it will be ending. I'm not going to take any bets anymore on when it will be ending, but there will be some pretty drastic changes for our residents. So just keeping you up to date on that. Any questions on that? I guess I would just add also the caseload for our economic support workers, and also like the Aging and Disability Resource Center. As people are losing these benefits, there's going to be huge workloads for those entities as well. I think it's going to probably touch every unit that we have in some way or form.
Right, next item is proposed meeting dates for next year.
Okay, so in your packet, we carried this over from last time in your packet. The proposed meeting dates are in there. You will notice I did add back in April since we shouldn't have any elections coming due and changes in our composition. I know there was discussion last time about increasing them, so I did increase them by one, and it's up to you for discussion on what you would like to do.
Anyone have any comments about that?
Can you share it on the screen? I don't have my copy handy.
I'll work on that, Matt. Hold on just a minute.
Well, I'll just add my 2 cents, and that is that I think more meetings keep us a little more current. I think when we have the long gaps, we have quite a bit of loss of continuity.
There we go.
So this is typically what we've done in years past.
Any questions or thoughts about that? Do we need a motion then? It says action requested, or just? do we
Yeah,
just-
if everybody's okay with that, we would just accept a motion to set these as our 2023 dates.
Laura Cruz.
I'll second.
All right, motion by Laura Cruz, seconded by Joy to accept those meeting dates for next year. All in favor?
Aye.
Aye.
Hi.
Any, oh, Laura Negro, are you waving to say something? Oh, I don't hear you. Oh. We're not hearing you if you've. Okay, Laura just says she wants to echo what Dr. Keller was saying about more meetings. All right. Sounds good, Laura. We'll hope you'll be able to get in there again. So the next item on the agenda is 2022 year-to-date expenditures.
And we have Amber with us now. Are you able to screen share, Amber? If not, I
Mic is
can.
off too.
You're muted.
I just have to say before Amber gets started that with Pete gone, she's our new comic relief.
No,
She's really, really funny, really funny.
he's trying. He's trying really hard. He hasn't quite succeeded with that. I don't think anyone can match Pete.
Can everybody see that? Okay.
Okay. I guess I don't have a whole lot to say. But if you have any questions, please feel free to ask and I'll try my best to answer them. Just kind of looking at the top there of where we're at. We're now entering that time of the year where most of the stuff will be coming out of the levy, with discussions with Pete and going over this, kind of guesstimating. Of course, it's going to be a big guesstimate with the out of home placements and those costs, probably being over budget, possibly a couple $100,000. But we'll see what happens here over the last few months. And we did see there we are under budget for the public health. That's doing good. There is some good, we have more grants than what was budgeted, so that does help with that, but I still anticipate possibly going over there. Anybody have any questions for me?
Doesn't appear so. Anybody? If not, we can move on.
No question, but can anybody hear me yet?
I can hear you. Yep.
Yep.
Woohoo!
All right, then we'll move on to public health updates.
Double checking to make sure that my computer is plugged in so my battery does not cut out this time. For the first thing, I just kind of have a smattering of different updates for everyone today. The first one just being for our environmental health programs. We are finally, knock on wood, it's staying that way, fully staffed for our environmental health programs. So Taya and Ken have been working through a lot of local business inspections as far as restaurants and things like that to catch up on overdue inspections, as well as catching up on and addressing any complaints as they come in. And they're making some very good progress as far as catching up with overdue inspections for compliance. And then the other aspect that I just wanted to highlight as far as program compliance, our DNR contract for Ashland and Price County has been completed, and our tourist rooming house inspections are probably the most in compliance that they have been in, I don't even know how long. Pam Fustel has really done an excellent job in organizing and tracking down everybody to get those inspections completed this year. The other thing that we have been very busy with as of recently has been flu season and immunizations in general. So for the month of October, we completed all of our scheduled flu clinics for interested schools and private businesses. We've also continued to provide COVID vaccinations throughout as well. So just a huge shout out to the staff that, assisted with all of that. It was a very organized and I would say probably one of the least bumpy flu seasons that we've had as far as getting into the schools and getting vaccinations done. So to just kind of give a snapshot of what we've done essentially just for the month of October, there were 86 Moderna bivalent doses, 114 Pfizer bivalent doses. And then in the school setting, in addition to the flu vaccine, we also offered all of the regular recommended childhood immunizations. So just a couple of the highlights for that, there were 45 HPV or Gardasil immunizations given, 33 meningococcal immunizations, and then 50 Tdaps or TD boosters, as well as a smattering of a few other things. And then for flu vaccinations, we gave a total of 652 seasonal influenza vaccines between the schools and private clinics and drive-through clinics. 148 of those were the high dose variety, so specifically for the 65 plus population. We did run out of high dose, so we will more than likely be looking at ordering an increased number of those for next flu season. We do have quite a aged population for Ashland County and the surrounding area, and there has been a significant high demand for them. So for the grand total for the month of October, Public Health administered a total of 995 immunizations. Our year-to-date totals, so from January 1st through yesterday, we have given a total of 1,822 different vaccinations. Some highlights from that. For the grand total, we're sitting at 846 various COVID vaccinations, whether it be the boosters or now the bivalent vaccines, 677 flu vaccinations, and then the other one that I picked out was 6 of the smallpox or the Genio vaccines have been given through our clinic as well. And speaking of flu season, it is off to a wicked start. We are seeing some of the highest numbers as far as statewide, as far as hospitalizations. It's the highest numbers that they've seen, for a snapshot for like this past week compared to years previous. These are the highest hospitalization rates that they've seen and I believe it's 12 years. So since back to 2010 was the last time the hospitalization rates have been this high. So in addition to influenza, we also have all of the other seasonal crud going around as well. Lots of RSV, rhino and enterovirus. And the other one that generally sounds more unpleasant when you just hear the name, but a lot of hand, foot, and mouth disease is going around. I've heard of multiple different school districts at this point in time with multiple different grade levels for the different school districts with hand, foot, and mouth disease, as well as daycare centers have been having outbreaks of it. So it's just, the reminder for everybody, anybody that if they're experiencing any symptoms, please, just remind people, stay home if you're ill, keep your kids home if they're sick. I know, we run into the hardship as far as, people need to go to work. There's no backup daycare for the kids. But I'm working from home this week as best as I'm able because we picked up influenza A from daycare because somebody was so nice as to send their child to daycare sick after they were excluded from school. So don't do that either. But yeah, it's just, the big thing of hand washing, social distancing. I think one of the school districts I talked to earlier this week was ready to throw tar and feather through the phone at me when I told them they could ask all of their students to start wearing masks again. So that was a great response there, but it's an effective infection control prevention measure. So, go back to the basics. And along with that, COVID is still out there. Our numbers appear to have leveled off for the most part. We seem to be fairly steady, even trending down. Weekly totals being around 10 per week over like the last month or so. The important detail to note with that is that these numbers are based solely off of the lab confirmed cases. So the cases that are reported in through, any lab monitoring systems. That does not count any of the home tests. Those are unreported, and with the availability of home tests and their frequency of use, we don't really have a good way to estimate the actual total number of cases that are out there, or as well as people just, plain old not testing of, oh, I have the crud, I have this, I have that, and then they don't test. There's also the risk for dual infection with COVID and something else as well. So just, we encourage people to continue testing. We do have test kits, the antigen test kits available through public health. So if anybody would be in need, we can provide those to them. If they are ill and they would like to pick them up, we ask that they call ahead and we will kindly throw them out the door at them rather than having them come into the building. Just because we don't necessarily want them coming into the building. We also do still have flu vaccine available. And then, as I mentioned, the COVID vaccines, we're currently doing the updated boosters for COVID by appointment. So we're scheduling those on Wednesdays. And then we also have scheduled to visit the senior meal sites throughout the county to offer the updated boosters as well. Some of those are actually scheduled for tomorrow. And then a few of them are scheduled into next week as well. And then the other update I had just pertaining to our overdose fatality review. So our group continues to meet monthly. And just of note, we have, there have been reports of recent uptick in overdose activity within the community. Individuals, calling 911, receiving Narcan and then refusing transport. Some individuals actually being transported to the emergency room as well. So just a reminder, if anybody would be interested in having Narcan for themselves, or if you know somebody who knows somebody who knows somebody, just have them give us a call. We can do it on a walk-in basis. It's a very brief educational training on how to recognize the signs of an overdose and how to administer Narcan, and we can provide that for them then. So and I think that pretty well covers my smattering of updates. Does anybody have any questions?
Yes, Liz, I have one. Is there a medical code for crud?
It would fall probably similar under the term for gorked.
Right.
Liz, this is Laura Curson. I'm wondering, and I guess this goes for everybody. I just don't feel like the community has a sense of how prevalent overdoses are in our community. The number of overdoses that have ended up in death. And I went through a number of my students or former students, and the number is appalling who have died. And I just have a sense that most people are unaware. And is that something that we can try to figure out how
Yep,
to
that's
bring
actually
awareness and get Narcan out?
That's actually something we've been talking about within, so between myself, the coroner, assistant coroner, and then one of the detectives that's a member of our overdose fatality review team. We're working on pulling together various different statistics as far as demographics for the individuals who have suffered from fatal overdoses, or the individuals that we know of that have successfully received a Narcan. So we're trying to pull together different aspects of that statistical information and kind of look at the demographics. The ultimate goal is we would like to do some sort of almost like a public service announcement of the, not to do it overly shocking type of thing, but something to the effect of, if you fall within X, Y, and Z category and you use these substances, you statistically are at an increased risk for a fatal overdose based on your peers, your counterparts, that sort of thing. So that is something that we are looking at and going to hopefully try to have additional information pulled together within the next couple of months.
Thank you. Appreciate that.
Any other questions for Liz? Otherwise, next item is elder abuse ordinance.
At our last meeting, Matt McKenzie had requested us to put this on the agenda. And shortly thereafter, I had reached out to my counterparts in my region to see if any counties had any ordinances that would address this. And I know Dan reached out to his counterparts as well, without success on his end either. Did you want to speak to that at all, Dan?
Yeah, no other counties have an ordinance like this. So I did talk to the DA, and he said the county board passed an ordinance that makes all felonies a crime in the county too. Then I did reach out to corporate counsel on this, and he said much the same thing, that the only option would be to empower the HHS staff to issue citations. And I guess, I'm not sure that's a good idea. That would put too much unnecessary danger on staff, in my opinion.
And just to put it in perspective, when there was a lot of discourse back and forth between when the pandemic started and issuing citations for people not following the stay-at-home rules and different things like that, we did not have support from law enforcement at that point. Not to say that they wouldn't back us up on this either, but I don't know. I guess we'd like you to have some discussion about what you would like to see. I don't think my staff or myself would be comfortable issuing citations, but that's up to you guys.
Yeah, and I agree with Terry.
This is Matt McKenzie. Can I speak, Clarence?
Yeah, go ahead. I was having trouble with my connection here. I don't know what was going on, but I couldn't unmute my mic. Go ahead.
That's fine. I guess I would not be looking for our clinicians or whoever from Health and Human Services. Obviously, if something like this is going on, it should be turned over to our investigator at the Sheriff's Department, who ought to follow through on it and take whatever matter is found to court.
Yeah, I agree.
Yeah, either the sheriff or the Ashland PD or Mellon PD or LaPointe PD.
Yeah, I don't think our social workers need to be put at any more risk.
I totally agree. This is Laura Cruz.
Any other comments? Otherwise, we can move along to approval of YASI policy. That's a new one.
Yes, so we are required, and I'm trying to share this, it was in your packet as well. We are required to have a policy for this screening tool, which Jerry's unit uses for youth who commit what would be crimes if they were adults. And so this is draft version for you to look at and hopefully approve. Jerry, did you want to say anything about this in general or specifically?
I guess what I would say about, so the state of Wisconsin has adopted the YASI, or Youth Assessment Screening Instrument, to be the universal screening tool for all youth justice programs for all 72 counties around the state, no matter how that particular program is administered, because different counties do youth justice programs differently. But the YASI is an evidence-based screening tool that not only measures the risk of recidivism in youth, but it also measures the needs of the youth and also the strengths of the youth that can be built upon to move that youth forward in the youth justice process. So the other really nice thing about the YASI is it actually follows the case all the way through to conclusion. The initial screening gives you the basic recidivism rate. And then when you do the full YASI, you end up with what they call the YASI wheel that identifies the different domains where the youth either has a strength or a need, and then the degree of strength or need that particular youth has in that area. Then using that, workers can bring that rate forward into their case planning, court reports. There will eventually be an interface with SACWIS, and that will allow us to bring the information from the YASI directly into our court reports in the EWSACWIS system that end up going to court with our recommendations. So when myself and my staff went through the training to be able to utilize the YASI, part of that was for supervisors to develop a implementation policy, and this is the result of our policy. The state did put out a template that they wanted you to basically kind of follow, but it didn't account for, so wherever you see like bullet points, there wouldn't necessarily have been any information in the template. It just kind of gives you an outline and you fill in your county specific information. So this is the policy that we came up with. It was submitted to the youth justice folks at the state. They ran it past I forget what the acronym, it's NISAT. I can't remember what the acronym's for, but I don't know. Do you remember that one, Terry? Anyway, they're the people that developed the YASI, and then they sent me back another version of our draft with little comment boxes on it for things that I might want to switch here or move there or what have you, and this is the end result. So I don't know that it's a super fun read by any stretch of the imagination, but you know, it's all yours now.
It is very detailed. And again, like Jerry said, the state has looked at it and given them their initial thumbs up. So we'd be looking for approval unless you have suggestions or changes.
So we would need a motion to approve this policy.
This is Supervisor Huber. I'll make that motion.
All right. Thanks, Rich. Anyone care to second that?
This is Laura Cruz. I'll second.
All right, motion has been made and seconded to approve the YASI policy. Any further comments or questions?
This is Laura Cruz. I didn't have a chance to read through it. I'm just wondering about making sure that it's culturally sensitive, takes into account, I mean, when you said strength-based, that's so great to hear, because often it's deficit-based. And
Mhm.
so I just want to ensure that, that we're taking into account an individual's family dynamics, cultural relevancy, and the importance of that.
That was actually really interesting in the Yazi training, Laura, because they talked about being able to pick out some of those specific issues. It talked about generational trauma and other trauma informed issues, and that was really something that they specified in the training itself. I don't know that it's necessarily worded in the policy itself, but as the workers were trained, that was really brought forward.
And I think the tool itself really limits the amount of bias people are able to inject. So there's some safeguards there as well.
That's good. I noticed that the motivational interviewing technique, and I've gone through that, and I think that's really a good process.
Any other questions or comments?
This is Supervisor Huber. I was wondering when this will be implemented then.
As soon as you pass it, we will proceed to forward it on to our staff to implement.
Okay, thanks.
Any other questions or comments? Otherwise, all in favor of approving this policy signify by saying aye
Aye.
or raising your hand.
Aye.
Aye.
Opposed? Motion carries. Written materials. Any comments by the department supervisors on any of the written materials or any questions of the board?
I think those are pretty much just updates that you receive every meeting. I do want to just add, I know we had kind of stopped doing our monthly reporting, and that will be initiated again every month for December. So you'll get more regular updates. And then if you have any questions on the stuff we email you, just feel free to reach out to myself or whichever department it pertains to, and we can answer those questions. So.
If there are no further questions, any board member updates or agenda items, suggestions for future meetings? George?
Yeah, I speak slowly because I may have a lag. I have two requests, which may or may not be completely appropriate. I'm sensitive to workload issues, but they're, firstly, I am aware that there's some interest in the Ashland and proximity to Ashland community in the possibility of a future swimming pool facility in this area. And I'm just wondering if it'd be reasonable to request a very brief assessment of the health and well-being benefits if we were to have such a facility, as opposed to the health and well-being deficits of not having such a facility. The reason for asking is that if we have even just a one-pager that is on the record, this may be useful when that question moves forward. My second request, and again, these are slow-moving issues, so it's not urgent, and I don't mean to request things that impose a significant workload, but we're in the stages of maybe where it would be appropriate from a Health and Human Services point of view to establish or to visit the question of long-term effects of climate change on the services and on the budget parameters for Health and Human Services. So we've requested this in the Land Conservation Committee, and we'll probably request this in other committees of the county board. There may be nothing, or there may be something that occurs to you that over time, this could have an effect on this department. And if that's the case, we'd like to anticipate that and maybe think about how we could deal with it and whether we need to go looking for money to deal with these issues. So that's just another request for a brief assessment to be discussed perhaps at one of our next meetings in February or April.
All right, thanks, George. Anyone else have any comments or suggestions for agenda items in the future? Any other business that we need to discuss? Hearing none, our
Clarence?
next meeting. Oh,
Clarence,
Go ahead.
can I make a comment just to just
ahead.
have the board be aware of something?
okay, go ahead, Jerry.
Okay, I just wanted to let everybody know that longtime friend to Ashland County Health and Human Services and extremely valued community member Randy Spangle had suffered a stroke
Oh,
this
no.
past weekend. And he is currently in the hospital down in Minneapolis. His family is with him. He is having some issues with speaking. He's able to walk around with some supervision, but I know that many of you know Randy, and he has been a very valuable asset to our department and the community as a whole. And so I just wanted everybody to be aware of that, and hopefully Randy will be in your thoughts.
Thank you for sharing.
Thanks,
that,
Jerry.
Jerry. I'm aware of that.
Any other comments by anyone? And our next meeting is scheduled for February 15th at 4:15. And at this point, we are needing a motion to adjourn.
So moved.
Second.
Second.
Motion made and seconded to adjourn. All in favor?
Aye.
Aye.
Opposed? Motion carries. Thanks, everyone.
Thanks
Thank
for
you,
running the
Clarence.
meeting,
Another
Clarence.
fine job.
Thank you.